Hi, I'm Kristi Frank, and welcome to America's Leading Doctors. This is a show that brings you the country's best and brightest professionals, as well as information you need to live a happy, healthy, and wealthy life. Joining us today is our special guest, Dr. Greg Schulte, who is the owner of Schulte Family Chiropractic and Nutrition Centers. Welcome to the show, Doctor. Thank
you, Kristi. Appreciate it.
So let's talk a little about your background and how you got started in chiropractic.
Chiropractic was very interesting for me. When I was in my early 20s, I became ill, very ill, and I had a lot of digestive issues. And I suffered for about 2 years. I went through a lot of medical procedures, took several drugs, nothing worked at all. For 2 years I suffered, and I could never find an answer. And one day this wise person called my mother, called me up and said, "You need to see a chiropractor." So I did. I explored chiropractic, and I found a chiropractor that integrated chiropractic care with nutrition, and here I am today. The health concerns I had are gone, and I haven't had them for 18 years.
So, Dr. Greg, did you start out practicing chiropractic and then adding the nutrition in later?
You know, Kristi, what happened is I started off with some nutrition in my practice, but what I found is what I was doing was hit or miss. It wasn't that laser focus that I wanted for my patients, so I kind of backed off of using it for a few years. Then I discovered a technique that was laser sharp focus that could really help me get to the root cause of the patient's problems, and I really stepped up and started using that more in my practice, and I've seen some phenomenal results with it.
So let's talk about someone comes into your office, is in pain, and do you set them up initially with a nutrition program, or do you address the pain and then set them up for the whole life picture?
It's a great question, because in my practice we could go either direction. What we do is we have a thorough evaluation of the patient, and we discuss the options with the patient. Based on my experience, I will let them know what I recommend, whether it would be a chiropractic case or a nutrition case. And some people are both. It depends on where the person's at and where they really want to go with their goals. If they want to just get out of pain, it might be a shorter case of chiropractic. If they truly want to get healthy, get the underlying cause of the problem, then we need to integrate nutrition into their care plan.
That's interesting. I'm wondering how tough of a sell is it to say, okay, someone, you're coming in for pain, now let's make you healthy and address your whole lifestyle. Is that an easy sell, or do most people?
Patients can't wait for it. They're so excited when we start talking about it, because they know that they need help in that area, but they don't know what to do. You walk into a vitamin store nowadays, there's 40,000 bottles on the shelf. They have no idea where to start, and they come to us, and we can get right down to the basic needs that they have right away, and things that will produce results for them, not just something where, well, take it for 9 months and see what happens.
I love that.
Yeah, it's great.
You have something interesting here. You talk about nutrition response testing. Can you tell us a little about what nutrition response testing is?
Nutrition response testing is a non-invasive technique that utilizes the body's neurologic reflexes to evaluate how things are functioning. So what we do is we're actually looking at how the body is at its current state, so we know where we need to bring it to. And it's a very easy technique to do. The patients love it. And then we actually utilize whole food nutrition, which is, the best, because it's grown without pesticides, without all the toxic chemicals in the ground. And it's real live food. It's processed at a very low level, so all the enzymes are there still naturally that the food was meant to be.
I love that about the whole food supplements, and I have heard that this is an incredible way to go. Yes. I have heard with your practice, though, that you see one member of the family, and the next week the whole entire family is coming in, and you're fixing the family as well.
Yeah, my practice is definitely a family practice. I've had up to 4 generations under care at one time. Really exciting, especially when you're helping little kids that are sick, and they've been through the antibiotics, and they've been through all the inhalers, and they're just not getting well. It'll treat the symptoms temporarily, but then it comes back again in a month or two, and the parents don't know what to do. They're not sleeping, high stress in the family, so if you can get one person healthy, they all really just kind of join in together. It's so much easier when everyone's on a plan together, because they can support each other.
So you're saying you can treat a child's illness and sickness like asthma, and name some things that you've helped families through.
Well, the technique doesn't actually treat conditions per se, but what it does, it helps raise the body to a higher state of health. So if someone has asthma-like symptoms, what we want to do is we want to support the areas in the body that are deficient, that are really needing the help, to try and help the body rid itself of those illnesses that it has. So I've had people come to me with things like breathing disorders, digestive disorders, skin conditions, are really big. Sinus problems are rampant in the Midwest. Allergies are really big also.
Wow.
These are things that we see almost every day in our office.
Wow, that's incredible. So, Dr. Gregg, what can a patient expect when they come to your office?
When they come to my office, we are very thorough with what we do. I'm not a doctor that wants you in and out in 10 minutes when we do the initial evaluation. We want to really find out what's bothering you and how we can help you and really see if you are a candidate for nutrition, because some people really aren't. So we need to make sure that we know that we can help them. We go through a thorough history. We go through a thorough evaluation with them. If they're going to be involving chiropractic in the care, that's also going to involve separate testing for that. And then we go through and we actually sit down and evaluate that information and bring the patient back in with their spouse or family members that might be supporting them, so we can explain that to everyone that's going to be involved in the process together.
That's a huge help.
Oh, yes, it's wonderful.
Yes.
Yeah.
Let's talk about one of your favorite patients, some of the benefits.
I've had a great patient. Just recently, this young boy came into my office, and you could tell that the parents were very, very distraught. He had some health concerns that a typical young boy doesn't have. He had severe dry skin around his eyes, very patchy, flaky. It looked just very bad. His eyes were sunk in dark circles. He had some digestive issues. He really wasn't doing well eating food. And his mom said he was very anxious. So not really that he was diagnosed with anxiety, but he was just a very anxious child and a little bit nervous about changes and changing things in his life. And what we did is we sat down and we evaluated, number one, the diet that he was eating. We had to look at the food that was going into his body, because that's the key. I mean, that's a large part of what we do. And then we also evaluated him to see what type of whole food supplements would work with him. So long story short, we worked with him. He just passed his 5-week mark in my office. The circles under his eyes are at least half gone.
Wow.
The dry skin is improving significantly. He's eating foods he's never eaten before. His mom comes in every day. She's amazed. She's like, he had fish today. He's eating mangoes, things that he wouldn't even touch before.
Wow.
And probably the biggest thing for him is this level of anxiousness is just fading away. At school, he's interacting with more kids. He's more willing to wear different clothes, which is a big thing for him. He wanted everything to be the same and very uniform, so he's really kind of coming out of his box. And I just talked to his mom yesterday, and it's great to hear these cases, and this is why I do what I do, because I know I can help people out there that are having these health concerns, and I want to do it. I just need to let them know about what I do so they can come find me.
That's so beautiful. Well,
Yes.
Thank you for helping cure our children and families. That's so special. Where can we go to find out more information about you and find out more?
The best place to really is to go to my website, which is schultechiropractic.com. There we have different tabs, and we have some information on chiropractic, some on nutrition, and contact information for my office to get a hold of me and my staff.
Thank you so much for being here with us today.
Thank you.
And thank you for being here with us today. We'll see you again next time on America's Leading Doctors.